In this video I'll share with you some very effective trigger point therapies you can do at home. Now these work really well and can provide some excellent relief, but there are a couple of things that you need to know. First is that trigger point therapies generally don't get rid of trigger points. They just quieten the trigger points down so they stop hurting. And that's one of the reasons why pain keeps on coming back. The good news is that if you keep going with the therapy, it'll keep whittling them away so they get smaller and smaller and hopefully go all together. Now, if you're using professional therapy, that would be very expensive, but if you can do it yourself, it's very affordable. Now, the second thing is that trigger points are usually part of a more complex musculoskeletal problem, and they're usually things that cause and aggravate them. Now, if you just do therapy and don't take care of that stuff, it'll be like fighting gravity. To get really good results, we recommend that you consult a professional who deals with that sort of thing. Now, you can combine your effective home therapy with what they do. Now, before I show you effective trigger point therapies you can do on yourself, we need to have a look at what trigger points are and how you find them. And simply speaking, trigger points are those tender lumps in your muscles that therapists find. There's been a lot of scientific papers written about them, but for the purposes of treatment, you just need to know that they're part of your muscle that have gone into spasm and cramped. Now, that tightness presses on blood vessels, restricting blood flow, which causes lack of oxygen to build up of waste products, which in turn causes more spasm and cramping, and the whole thing keeps going around in circles, building up like a snowball until it starts hurting. Now that's really important to know because it tells us to be effective, trigger point therapies need to disrupt spasm, relax muscles, and increase blood flow. Now you know that, let's look at how you can find trigger points. Now what you're looking for is tender lumps within tight bands of muscles. Now there are two good ways you can find them. I'll demonstrate both on my forearm because it's easy to show on camera. Now the first is the way I did it in clinic. Now start with your fingers flat and do a general examination of your muscles. Now, if you find anything that's a bit tender or tight, you can use one or two fingers to explore a bit deeper. If you find tightness, you can follow it along and see if you can find a tender lump. Now they usually shoot pain when you press on them, and sometimes they might even make your muscle twitch. Now the second way to look for trigger points is to lubricate over the muscle and start doing stripping massage like you're squeezing an old sponge. Now as you do it, you'll feel it if you come to a tight spot or a lump. What I'd also do is, if you're consulting a professional, ask him or her for a bit of coaching. Now they can make sure you're doing properly, and they can also make sure you're finding all the important ones. Now you've found your trigger points, let's look at your effective home therapies. Now there are two basic types, those based on manual massage techniques and those using vibration massage. Now looking at the manual techniques first, professional therapists sometimes use techniques where they use painful pressure. Now we see a lot of people trying to copy those techniques with things like balls and rollers, but for reasons I've discussed in my article about foam rollers linked in the description, it's not very effective. And as a chiropractor, I've seen way too many people hurt themselves doing it. Now, I don't want you hurting yourself, so I'll show you two relatively safe and effective manual techniques. The first is just an extension of the second examination procedure I showed you before. Now, as you're squeezing along the muscle and find a tender lump, just stop and hold the pressure for 5 to 10 seconds before slowly moving on. Now I've separated the examination and treatment for teaching purposes, but in practice you combine the two. You move slowly along examining the muscle, and when you find the trigger point, you hold the pressure to treat it. The second very effective manual home therapy is based on traditional Thai home massage. Now, trigger point therapies done by professionals often involve applying a lot of painful pressure while the trigger point gradually fades. As I said, when people copy that themselves, they hurt themselves. Instead, with the traditional Thai method, you just apply moderate pressure to the trigger point for 5 seconds, then release. That's repeated 5 times in a session, and then that session can be done every day. So, just say the trigger point in my upper trapezius muscle. As you can see in the pic, people doing it using a cool looking tool, but I'll just use my fingers. Now find the trigger point, apply moderate pressure for 5 seconds, and then stop. Now repeat that 5 times for each trigger point, and then I can repeat that each day. Now you're only using moderate pressure, so it's very safe, but scientists tested it in a clinical trial and it gave great results. Now I'll put the details in the description. Now the other type of effective trigger point therapy, and the one we recommend, is vibration massage. And I'll link the instructions on how to use vibration massage in the description, but basically all you need to do is place the head of the vibration massager over the trigger point and let the vibration soak in for about 30 seconds. And like any of the other trigger point therapies, it can be repeated each day while the trigger points gradually fade away. Now there's several reasons why we like this one very much. You don't need any special skills to use a vibration massager. Because of that, they're very easy to use and give consistently great results. Now you're not pressing in, so it's a lot safer, and as long as you have a proper machine with a decent handle, you can use it anywhere on your body without having to get into difficult positions and putting pressure on yourself. And the best part about vibration massage though is it's incredibly effective. Scientists have found that the vibrations soak in and disrupt spasms, relax muscles and increase blood flow, flushing out the waste products and bringing in fresh nutrients. And that's exactly what the trigger point therapies need to do. Now, one warning I need to make: to use vibration massage, you need a proper vibration massager that's built to deliver professional standard vibration, like one of these. And most consumer machines are not capable of delivering proper vibration. It's also a problem with percussion massagers because they try to drive the head in like a jackhammer rather than deliver vibrations. Now that makes them more dangerous and less effective. Now I'll link more about that in the description. Finally, we've got massage guns. As well as having those two problems, they don't even have a proper handle, so you can't use them properly on about 1/3 of your body. Now if you've got any questions or comments, I'd love to hear from you. You can either leave them in the comments or send me an email. Anyway, thank you very much for watching. It's been most appreciated.